Let's talk about lasers and vulvovaginal health. Frequently, I've been asked about the role of lasers in vulvovaginal health. So to start the conversation, let's talk about what are we using lasers for. And one of the most common reasons to use a laser is genitourinary syndrome of menopause. And that includes vaginal dryness, pain with intercourse, frequent urinary tract infection, urinary urgency and frequency. And it all happens due to the hormonal changes usually associated with menopause. Women often describe those symptoms as feeling dry, feeling like being aware of their vagina, go to the bathroom all the time, and sex becomes very painful. So there are different treatment options, but not every laser is the same. There are different types of lasers: ablative, non-ablative, and radiofrequency lasers. How are they different? The ablative lasers work by creating a micro-injury on a surface layer of the tissue, and by doing that, promotes the collagen growth. Non-ablative lasers, they heat up collagen and protein in underlying layers of the tissue. Radiofrequency lasers are very similar to non-ablative lasers, so they create the changes in the underlying layers of the tissue by heating up those layers. The main difference between non-ablative and radiofrequency lasers is the depth of penetration, with radiofrequency lasers being able to penetrate deeper in the tissue. So when is the lasers indicated? When there is a genitourinary syndrome of menopause, vaginal dryness, some vaginal laxity, and vaginal looseness. But those two last conditions are not very clearly defined and very subjective. Vaginal laxity, usually described by women, how feeling like a looseness when they're having sexual activity. But once you do exam on the women complaining of that vaginal laxity, you can see beginning stages of the pelvic organ prolapse. One of the indication is the vaginal rejuvenation. And we all heard the term vaginal rejuvenation, but there is actually no medical definition of the terms or what it means. So based on the multiple studies that have been done, the lasers can help improve genitourinary syndrome of menopause. However, we need more studies to evaluate what is the optimal regimen of administering the laser treatments, and should we give laser treatments on their own or in conjunction with hormonal treatment options. There are also some studies that showed that the stress urinary incontinence and overreactive bladder symptoms improved after receiving the laser treatments. Who is not a good candidate for the lasers? Well, if you have unknown vaginal bleeding, that's something that needs definitely to be evaluated. If you had a radiation on your pelvic area, lasers not gonna help with improving quality of tissue. And if you had a pelvic prolapse repair done through the vagina utilizing a large mesh kits that were used before 2016, you should definitely disclose that to your physician, because the current recommendation is to not use lasers over mesh. The exception is urethral sling. Sling is the small piece of synthetic material, basically mesh, that considered to be a gold standard for the treatment of stress urinary incontinence. We still use it and it's very effective and safe. The reason why we still can use laser even with a sling in place is because it's a very small piece of the mesh and we can avoid that area. So if you scheduled to get a laser treatment done, you do not need a special preparation, you do not need to fast, but make sure to wear a comfortable clothing. Also, if you're someone who gets a herpes outbreaks or cold sores, make sure to talk to your doctor, because your doctor might want to prescribe you a few doses of Vulvov to prevent a potential outbreak after the treatment. If you feel like you have any vaginal infection, make sure to check with your doctor before scheduling the procedure. The vaginal treatment should only be performed if there is no infection in the vagina, is in a good health. So what to expect when you come in for a laser treatment? There are two main areas where the laser can be applied: internally in the vagina or externally on the vulva. If you're receiving the treatment for the outside of your vaginal opening, for the vulvar and labia, you will receive the application of the topical numbing cream to decrease the discomfort. And if you're receiving only vaginal treatment, you don't really need to have a topical anesthesia because vagina has a different type of pain receptors, and procedure is well tolerable without any numbing. No matter what type of laser will be used for the vaginal treatment, it usually consists of the vaginal probe that has an area where the laser energy comes through. And that probe is usually inserted and the treatment administered to cover the whole area of the vaginal canal. Treatment can take anywhere between a few minutes to half an hour, depending on the type of laser. After the treatment is done, you can go home and make sure to wear a panty liner because you might have some discharge, and that discharge might be brownish or even blood tinged, but it's nothing to be concerned about. Feeling discomfort for a day or two is totally normal, but if you feel like your discomfort is continuous for the few days, make sure to call the doctor's office because you might develop vaginal infection. And it's recommended to avoid sexual intercourse or using tampons for a few days after you had the procedure done. And in general, lasers work best in a dry environment. So if you're on your period, it's better to avoid the treatments during that time. So schedule to have your treatment when you're not on your period, ideally after your period and not before. As the lasers became more popular and more accessible, a lot of med spas started acquiring those lasers and offer vaginal rejuvenation. I would caution you to not go to those places and rather see a physician at the doctor's office that can evaluate you appropriately, make sure you don't have any contraindication to get laser treatment, and especially if you had any procedures done in the past. And the doctor will know best how to treat you on a case-by-case basis. It's very important to receive your care from the licensed medical practitioner, because also overuse of the laser can cause fibrosis and scarring of the tissue.